Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer and Associate Professor of Medicine, Program Director in Internal Medicine in the United States. So we're going to continue our journal analysis, scientific research paper analysis, and give a critique and kind of update you what's going on. We are talking about triple therapy or like a new combination of drug in multiple myeloma. Okay, that's the whole article. This article was published in New England Journal of Medicine, and the name of the article is Belantamab Mafodotin, pomalidomide and dexamethasone in multiple myeloma. It's very hard to pronounce the name of this drugs in cancer therapy. Okay, so let's recognize the authors first because they do a tremendous effort into this. Melitios Athanasios Dimopoulos is the primary author, a doctor, and then looks like the senior author is Susan Trudel, MD, with the DREAM8 investigators. So let's look at the study question on this. Does the combination of Belantamab Mafodotin plus pomalidomide plus dexamethasone, which is actually called a BPD, does it increase the survival in patients with relapsed or refractory multiple myeloma, which is called RRMM, compared to pomalidomide plus Bortezomib plus dexamethasone, which is called the PVD group. So there's pretty much they're looking at this BPD group combination versus PVD group, which one has higher survival when you have relapsed refractory multiple myeloma. Multiple myeloma, there's new drugs coming up. Myeloma diagnosis is not very poor, have a lot of complications. So we need to look at the new drug and see what I mean. So when you took up multiple myeloma, there's an increased mortality, but no new drugs are coming in. So this study, we're looking at the relapsed or refractory multiple myeloma. That means they have undergone treatment before and they have relapsed, and then is there a benefit of the new drug? That's the question. We're going to look at this BPD, which is Belantamab Mafodotin, pomalidomide and dexamethasone. It's a BPD combination, and then you have the PVD group, pomalidomide plus Bortezomib plus dexamethasone. It's a PVD group. Okay, all right. So let's look at the design. It's a phase 3 randomized multi-center open label trial. And how many patients? They have 302 patients are randomized. 155 in the BPD group, 147 in the PVD group. So inclusion criteria, we talked about, we're not talking regular multiple myeloma here. They already have undergone treatment with the lenalidomide exposure. They have been treated with the lenalidomide, okay? And they become refractory and relapse, and they were dying after. So all these people have undergone treatment. They are relapsed refractory myeloma. That is the inclusion criteria. Exclusion criteria is there an infection, prior B cell maturation, antigen target therapy. And the intervention, again, we talk about two combinations, right? We got the BPD, we got the PVD. BPD, again, Belantamab Mafodotin or pomalidomide plus dexamethasone, 3 drugs. And the PVD combination is pomalidomide plus Bortezomib plus dexamethasone. Outcome measures, we all have to look at the primary endpoint. That's very important. The study is powered for the primary endpoint. Okay, this overall response rate, that is what the overall response rate, the patient was able to live, and that's the main thing. Secondary endpoint is the progression-free survival, PFS, overall survival, and the safety. Okay, now statistical analysis, very well statistical design, randomized control. They looked at the hazard ratio, proportional hazard model, Kaplan-Meier method. We looked at the survival, response rate. They used the chi-square method. They also, anytime randomized control, if they use intention to treat, I like that. And they also had O'Brien-Fleming method. That means sometimes, every study, sometimes people die in the middle and then you have to stop the study. If you don't do O'Brien-Fleming method, it's kind of hard to catch that. You continued the study and people were dying, forget the dying. Even if it's a benefit, they should stop the study, okay? That's the main purpose of that. So statistical, the follow-up, The follow-up is 21.8 months. And then let's look at the progression-free survival. The 12-month progression-free survival is 71 in the BPD group, and the other one is 51% in the PVD group. Okay, remember that's a big difference. Hazard ratio is 0.52 with a very good strong confidence interval. The narrow confidence interval is better. P-value less than 0.001 if you want to look at it. So very statistically strong results. That means 52% of the time compared to is better in this group, okay? The response rate, partial response, 77% in the BPD, 72%, and complete response, 40% here, and 16% in the other group, okay? So there's a nice study looking at the Kaplan-Meier curve, and you can see the difference. Now, safety, I mean, I think they looked at the main thing about the safety. Anytime new drug come in, we have to kind of look at it. In the BPD group, unfortunately, have a lot of safety events. Your eye. So if you're taking this drug, you need to run to your ophthalmologist and get it checked out, okay? Some people in the study, like 9%, they stopped the study because of the ocular side effect. Now, number needed to treat. So how do you calculate the number needed to treat? 1 divided by absolute risk reduction. So 77 minus 72%. 1 divided by 5%, that is 100 divided by 5. That's number needed to treat to find a benefit is 1 in 20 patients. Okay, it's pretty good. When you look at the strength of the study, it's a multi-center study, a randomized control study, robust statistical method, O'Brien-Fleming method, we said. It's a pretty good, like, use the method to prevent study. A lot of people dying in the middle of the study, you should stop it. A lot of people surviving in the middle of the study, you have to stop it, okay? The weakness of the study. I think the main thing, if you look at it, is Black and African Americans are extremely high risk of multiple myeloma, and they suffer a lot. And this is like pretty much we don't have any African American. It's not good. So we need to add more people. I mean, it looks like more they have chosen maybe younger, healthy people. Medium age was 67. The performance looked at it. They have a low performance score status, but the performance status was a little bit high. And the studies have shown if you have lower performance status, the worse outcome. Okay. Now, that is when they measure the performance, they use that ECOG scale. And some genetic mutations also are linked to more aggressive disease. So you have to make sure, like you might have taken the people more sicker. Kidney function, I did not see any kidney function associated with poor outcomes. So they should have definitely looked at the creatinine, both group. And the one thing I don't really like is what? Writing assistance provided by Nucleus Global. Who are this Nucleus Global? I kind of did some literature search, okay? Nucleus Global is a company, they write, if you want a paper, they write it for you. It looks like the reputation is pretty good. But come on, if you are a researcher and if you know the study, why do you need somebody else to write it? And I don't like that. It should not be allowed. When you have hiring other people to write it up for you, you should make the first draft and let them correct it. So please, I think all this research publication, if somebody else is writing, I don't like this. I don't even know what's Nucleus Global. They don't know anything about the study. When I write a paper, I always make sure I write the first draft and then I ask somebody to take a look at it, because who knows? The primary author pretty much know what's going on in the study, right? Who cares if there's a little bit of mistake? I rather, the guy who has the primary author make the mistake and then compare to another company. So please, any of this, I'm telling you, like all this New England Journal of Medicine, don't let other companies write it for you. Let the primary author. If he doesn't write it, don't publish it, okay? Ocular events is a big problem in the study. Keratopathy, vision blurring, dry eye, photophobia, eye pain. Everybody get checked out, that's good. But you need to worry about your eyes. See your ophthalmology. I think they adjust the doses very good to prevent a lot of complication. almost like 80 to 90% in this study on this BPD. Okay, so take home message: the combination BPD, Belantamab Mafodotin, pomalidomide, dexamethasone, significant benefits in the patient with the relapsed. Okay, not the regular. If you have a relapse or refractory multiple myeloma, there's a good benefit study. It's a pretty good strong study right there. It's important. I kind of look at this. Actually, this company, GlaxoSmith, he's the one who published the study. They make the drug, I think. So I just kind of looked at their stock performance. Okay, right now they're selling at 34.09. Anytime a study comes out, I look at the pharmaceutical company. None of us want it. There's nothing wrong with the investing companies and all of that too. I'm not trying to promote any companies. So when they published this article on August 1st, the stock was around, I think, 36. It went up to like 44. In a month, stayed there and then bring it down. Okay, I'm just kind of letting you know this is the stock price. You make the decision. Thank you so much for watching. God bless. Please send your friends to subscribe. You subscribe. We need your support. God bless. Okay, thank you.